By the time we came back, we have reproduced almost 180 questions.
Multiple choice question.
Multiple choice. And out of 180, you can assess that how much have you done. So, this is not the case with AMC. So, AMC, there are four options. They're similar in one question. And you have to differentiate unless you have clear-cut concepts.
सबसे अच्छा मतलब यही है कि आप प्लैब या
So you prepare for the difficult exam for AMC and PLAB and IRIS will be easy.
ये है कि यहाँ पे आप ये जो वो मल्टीपल चॉइस क्वेश्चंस हैं उसका आप जब भी यहाँ पे एक प्रोग्राम हो उसको आप दें लो जी
regarding multiple
ये करें जी ठीक है और सबका आप लेक्चर उसके बाद ये मेरा ख्याल इससे प्रैक्टिस भी होगी और आदमी थोड़ा सा वो
I have a different opinion about multiple choice questions. I always prefer to do multiple choice questions if you have got some background knowledge. Then you understand the multiple choice question well. You separate each and every option effectively. And if some points are not there in those books which you have read, you can add on. Right? Because no book is complete. There is some deficiency and you can fulfill your deficiency by doing MCQs. So read the text first. If you start from the MCQs, then you will just ram the MCQs and then you will fall in the exam. So first you have to have some background knowledge and then you attempt MCQ. That would be because 5 options, 5 topics. And you should know each and every topic. This is not there, this is not there, this is not there. So that you can only do if you do MCQ straight away, then you will suffer.
नॉलेज भी हो इस तरह नहीं चाहिए कि मैं बहुत सारी किताबें पढ़
No.
कुछ नहीं करना जो डॉक्टर साहब ने पढ़ा देना वही काफी है
वही तो है
So
वो काफी है
so you have knowledge. That knowledge
वो बताएंगे ना जब
So you have to bank on your concepts because you can't cram each and everything. You can't cram secretary, you can't cram pediatrics, you can't cram the medicine, but you should rely on your concepts and use your experience to good effect. You all of you have plenty of experience. Use your experience to good effect. Once you start preparing for these sort of exams, don't assume. Don't do the question on your own experience. First, you should have some text in your mind. Then apply the clinical knowledge. Then apply your clinical experience, and then you will be at absolute ease.
Yes.
So if you don't study, you will start assuming the things on basis of your experience. So we already all, including me, we all have developed bad reflexes until we study.
अच्छा डॉक्टर फैसल अब ये है कि ये तो हो गई बात अब लेट्स से आप लोग इसको करना चाह रहे हैं तो आप हमें क्या
So my advice is you want to do PLAB, you want to do AMC, everybody starts with the medical preparation and just chip in with IELTS. So if anybody is determined to go to Australia, okay, fine. Take 6, 7, 8 months time, go to Bangkok, pass your AMC one, and then take IELTS. If you want to do it step by step. But if you have done IELTS first, and even then you have to go to Australia, very nice. You pass, you go to Australia and then take exam over there. Because take exam over there in Australia, in some center, whether in Perth or Western Australia or Sydney, wherever you want to go, there are plenty of centers available over there. So you take exam over there, stay over there for 4 weeks, get your result, and then apply for a job.
Near future में कोई chances नहीं है कि इस्लामाबाद में या किसी जगह पे ये
No, they have security issues. They will not do it. Now they are.
रिकॉर्डिंग में आने नहीं
Now they are earning a lot of money.
Yes.
Why should they open the center? And previously, 3-4 years exam was very easy. There were certain notes, question pool available. People never study the text. They do those MCQs and they pass the exam. But someone amongst us, they gave those notes to their medical class. So they have thoroughly changed the pattern. They are now the pattern of USMLE. So, boy, people are.
Are the basic subjects included in the course?
No basic subject in any of the exam we have mentioned.
So, let's say
certain basics, just few. Those are relevant basics. Just ACE inhibitors, how do they produce cough or diuretics, how do they act, where do they act.
Not detail.
उसमें सारा ही आ जाएगा, anatomy, physiology, pharmacology, pathology.
Background knowledge.
Yes, if there is mass-like phase and resting tremors or cerebral ganglia, so that's a relevant.
ओके ना सब, अब ये बात हो गई, अब फर्स्ट करें हम लोगों ने एनरोल कर लिया, हमें क्या टाइम फ्रेम देंगे कि हम इसमें कवर कर लेंगे जिस तरह से?
The things we discuss on that day.
Yes.
If we go 5 days a week, that is difficult for everybody. If you are in busy practice, that is difficult. 5 days or 6 days a week, then we can finish it in 4 months. 4 months. Because medicine is huge. In every exam, there is major bulk of medicine. And that 70-20% is medicine. Because most of your pediatric topics, they are under medicine. Your leukemia, your lymphomas, your rheumatic fever, your endocarditis, your meningitis, your encephalitis, your parasites, your skin diseases. So most of they come under heading of medicine, right? So medicine does take time, around 2.5 months. So it is 2.5 months for medicine, and then 20 days for 15 days for gynae, 15 days for pediatrics, 10 days for surgery, and 5-10 days for psychiatry. So that is all. So most of the bulk is medicine. So if you don't know medicine, you do the rest of the subjects, you will not pass it. Because most of the gynae questions, for example, pregnancy-induced hypertension, it is there in medicine. Right? So pelvic inflammatory disease comes under infectious disease. So there is a lot of overlap. So in surgery, most of the surgical topics, they are also in medicine. For example, the head injury, the stroke, so you study stroke under medicine as well. So they will not ask you how to do the appendectomy and how to do the including toenail and all that. So most of the topics, just chest injury, pneumothorax, most of those topics, they are in medicine. So in medicine covers most of the other subjects as well. So it will take time. It will take at least 2.5 months if we go 5 to 6 days a week.
If we cut it down for 2 or 3 days a week.
If we go 2 days or 3 days a week, then it will take 8 months or 9 months. It will double the time.
उसके हर सिस्टम को
during my discussion, I used to deliver. I use the pen and the pencil on board. I never prepare the prepared material. I deliver the clear concepts with references. Right?
That's right.
And you can study any book. Right? And then I will tell you that during our discussion, this question can be asked this way, this can be asked this way. This is the important point. Right? So you have to bank on the concepts. You have to bank on the concepts. Yes. So you have to bank on your concepts. So I will try to deliver. Will try my level best to deliver the clear concepts. So that is all.
Thank you so much.
Any question, any confusion?
मेरे पास कुछ बुक्स पढ़ी हुई हैं MRCP की, MCQs काफी मेरे ख्याल बल्क में पढ़े हुए हैं, कभी लेके आएंगे।
जी
MRCP की। No, not GP, MRCP. वही सारे क्वेश्चन इसी का मल्टीपल चॉइस क्वेश्चन।
बेटा साहब, अब ये है कि हम इंशाल्लाह विल हैव अनदर मीटिंग, अब आपके साथ रेडी है ना, हम आपको बुला लेंगे। दूसरा गेट्स रजिस्टर्ड, देन विल इन्फॉर्म।
मैं अपनी खुद लाइब्रेरी का में बनाएंगे।
डॉक्टर साहब हमारे पास वैसे हैं कोई तकरीबन 9 माह तक, 9 या 10 माह।
फिर किधर
तो उसके बाद इन्होंने चूंकि ऑब्वियसली हमारा जॉब, तो ये हम चाहते हैं कि यही हम अवेल कर लें।
Meanwhile, my wife is preparing for the exam.
ये है कि
once she has finished with that, then
अब ये हमारे पास
डॉक्टर।
yes, she is doctor. She is after Quran as well. So
माशाल्लाह।
तो ये हमारे पास टाइम है, अब आपने फैसला करना है कि हम जितनी जल्दी हो सके इसको स्टार्ट करें। अब जो भी इंटरेस्टेड है वो हमारे इधर रजिस्टर करा दें ताकि हम इसको शुरू करें।
one thing I want to tell you that you have to do a slight hard work. Slight hard work.
Slight
You have to hard
Yes,
work.
hard work.
You have to work on slight first. I use the word slight so that you should not run away. So you have to.
हार्ड वर्किंग
You have to either you have to cut on your sleeve or you have to cut on your practice or
कुछ ना कुछ करना पड़ेगा।
you have to cut on your vacations or whatever.
Can you guide for IELTS preparation?
I will give the outlines.
वो का
I will give the outlines. If you practice on those outlines,
आउटलाइन दे देंगे तो उसमें
I myself, because IELTS is basically a technical exam. It's not really a true test of English. We all have got good English. Vocabulary, we have got good vocabulary, we have got proper sentences, we have no problem with the language. It's the technical things where we do suffer. We might suffer in spellings because we are away from the common language. We might suffer in conversation or communication. So that we learn with practice. But you have to practice on your own, not rely on the academies. Clearly speaking, I did the IELTS for Australia in second attempt. Why should I tell a lie? I cleared it in second attempt. First, I did IELTS in 2005. At that time, I took exam in UK. And that time I had 7.5 in every section.
Actually,
so at that time I did in first attempt. But here
FRCS, MRCP फर्स्ट अटेम्प्ट पे नहीं क्लियर करते, फर्स्ट पार्ट कर लेते हैं, सेकंड पार्ट करने के लिए वहाँ बैठे रहते हैं, फिर वो उनकी अपनी ट्रेनिंग्स होती हैं. जिस तरह DCH के लिए 3 मंथ की है, वहाँ पे जिसने भी जिस स्पेशलिस्ट से जिसका ताल्लुक है, पीडियाट्रिक्स में करना है तो उसकी 6 माह की है, उसको उनके अपने हॉस्पिटल में ट्रेनिंग लेनी पड़ती है, उनकी अपनी रिक्वायरमेंट्स हैं.
You have spent a lot of work in a lot of time in.
मैं तो बाहर
How much? In Glasgow.
Frankly speaking, I was about 4 months in Glasgow. I took training in postgraduate training in pediatrics, and then I appeared in the exam of Royal College, you see, for DCH. But unfortunately, I passed by, you see, theory, I passed by Viva, but practically they failed me. Frankly, you see, because there was a apnea control here. He asked me, what is this? I forgot that. And he said, you are not looking, what is this? And that was a child of pulmonary dysplasia, okay? And that child was about, I think, about 7 to 8 months old. And they asked me that, what is the problem with him? And there was, you see, subcostal recessions, and there was, you see, tachypnea at that time. But I forgot. He was saying that, what is the purpose of this? I forgot that. You see, I was perhaps it was apnea control.
Okay,
my question is, you have seen a lot of people in Western world who damn care about post-graduation. They are working over there like horses. They are earning money. Their main focus is to earn money, right? And for to earn money, you have to pass some of the registration exams. Either you pass PLAB, you pass Irish exam, or you pass AMC. That is the first thing. And those things come after that. If you want to train yourself in one of the subspecialty, then you have to take exam. But first you have to get a job over there. So that's the main issue.
क्योंकि उसमें बाद में आपने सोचा यार इतने पैसे में खर्च करूंगा, अगर जॉब आपको मिल गई फिर तो आप इजीली वहाँ गुजारा कर सकते हैं.
So if you have worked over there, then you might have passed the exam.
बिल्कुल बिल्कुल, yes, that's correct.
To pass the clinical exam, you have to work over.
Because after that, I came back to my country. I thought the money, you see, while I was working in Iran, you see, that was there in Britain, and I thought that why should I waste my money?
And you people must have an idea by MRCTP exam that if you don't work in the Western world, you will not know how to address your patient. या आप उसको पहले नाम से बुलाना या उसको सेकंड नाम से, और you thank your patient, you have to care your patient. How much do we care in our setup?
तो बहुत से
excuse me, after we just go to finish. तो ये आप हमारा टाइम फ्रेम आपने बता दिया है, और anything else you want?
It will be 2 hours session, right? Usually we finish it in 1.5 hours. 1.5 hour for question answers. But as a whole, it's a 2-hour class.
2 hours.
Because once you start a topic, then question comes from anybody. Then he's unable to understand that one. So question answers, they go side by side. So it does take 2 hours.
2 घंटे का है.
4:30 to 4:30. So question answers 4:30 at the end of the session.
It can be at the end. It can be thrown in the session.
Okay. 4 to 6 shift to 4 to 6.
4 to 6, 4:30 to 6:30. But whatever the time, is game time.
Yes, of course.
Because 4:30 means 4:25.
4:30 to 6:30.
4 to 6 is okay.
लेकिन ये सब के लिए feasible time ताकि तो सिचुएशन आज हुई है ना हो टाइम पे आ जाए.
आज हुआ है थोड़ा लेट हो गया, तो मेरा ख्याल 4:30 का टाइम.
So whoever wants to attend, should come from day one, because then I will not repeat it. Because then if someone join later on, then
I think the other thing is that we are not recording this doctor's talk.